I'd like to call this meeting to order November 5th, the meeting of the Board of Directors of Palo Verde Health District. Please stand for the Pledge of Allegiance. Okay, I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Okay, Joanna, please take roll.
President Carmela Garnica,
Here.
Vice President Rosie Rowell.
Here.
Director Trina Sarden is absent. Director Dr. David Brooks.
Here.
And Director Sandra Hudson is absent.
Okay, public comment. This is an opportunity for citizens to speak only on items listed on the agenda. For the record, please state your name. The board has a policy of limiting any speaker to not more than 3 minutes. Public input may be offered on an agenda item when they come up for discussion and or action. If there are no public comments. Any public comment? Okay, there is no public comment. Is there any board comment? Okay, not either. Okay, item 4. Is there a motion to approve the agenda? It's been moved and seconded by Rosie and seconded by Dr. Brooks. None. Call for the question.
Vice President Rowell.
Aye.
Director Sarden is absent. Director Brooks.
Aye.
Director Hudson is absent. President Garnica.
Aye. Okay, action items. Employee health benefits increase. Michael Rose.
Yes, good evening, everyone. Open enrollment is underway, and we've reviewed the district's contribution levels for employee health plans. Our benefits provider, SDRMA, has announced plans for costs to increase by over 13% in the next year, 2026. Now, the draft fiscal year 2025-2026 budget, which was presented this summer, included a 5% increase in employer contributions to employee health plans based on what we had seen from the Kaiser Family Foundation as an estimate. Now, given the district's current financial position and bankruptcy proceedings, we cannot responsibly increase contributions beyond this 5% without cutting other critical expenses. So the district currently covers in 2025 66 to 80% of health premiums. It's now going to be 61 to 74% of total health premiums for employees. This is still a strong and competitive contribution level. The 5% increase is meant to maintain meaningful support for employees while ensuring we stay fiscally responsible as a district. We did evaluate other cost-saving options, but none of these offered a better value or was advantageous for our employees who are doing a lot of work under very difficult circumstances, and we were concerned about any added burden beyond what was already proposed in the draft budget. Now, the fiscal impact of this in the draft fiscal year 25-26 budget included $575,000 for total employee benefit contributions. This amount reflects the proposed 5% increase and keeps the district on track with the draft financial plan. So staff recommends the approval of the 5% increase in the district's contribution for the calendar year 2026 health benefits, which is consistent with the draft fiscal year 26 budget.
Okay. Okay, is there a motion to approve the 5% increase of the district's contribution from?
I'm sorry.
Madam President,
Thank you. Go ahead, Joanna.
would you like to ask for public comment?
Okay. Is there any public comment on the item that Michael Rose just spoke?
Yes,
Okay.
like, it's nice agenda, it's spelled out. And what I heard was it's employee, I thought it was salaries, but it's for the health benefit. But according to this, there's 66 to 80% of the health care is paid by the hospital to the employee, and the employee takes care of the rest. That's only about how this reads.
Michael or Vanessa, can you respond to that? Or do you have it, Ms. Anaya?
No,
I can
Michael,
respond.
what is the portion the hospital pays? That's what the mayor is asking.
Okay, thank you for reiterating. It is a little bit hard to hear. The 66 to 80%, that's dependent on the plan that the employee elected in 2025.
Okay,
So that is the district's contribution. The remaining percentage of that would be made up by the employee through payroll deductions.
Thank you. And then it's stated the total cost last year was 575,000, correct?
For fiscal year 2025, 2026 budget, so that is the current fiscal year, is estimated at 500 or budgeted at 575,000.
Well, just roughly running the number at 5%, that will increase this year's budget or whatever this would cost the district another 29,000 roughly.
No, the 575 includes the 5%.
575 includes that? Okay. Okay, I'm just trying to get a better understanding. Thank you.
Understood.
Okay, is there any board comment on this item?
I just want to get, Michael, you were
Mhm.
saying that the healthcare interest wanted to raise it 13%, but we're talking about 5%.
So
Yeah.
yes, Rosie. So what happens is initially the best data we had when preparing the draft fiscal year 25-26 budget from Kaiser Family Foundation was that on average, there's a 5% increase in insurance premiums every year. However, this year it's over 13%, depending on the plan. They're all over 13, but they can range a little bit depending on which plan the employee selects. So with this, we had not planned on a 13% increase. We had planned on a 5% increase, and we had budgeted for a 5% increase. So what we're proposing is we stick with the 5% budgeted increase per the draft budget. That additional 8% is going to have to be absorbed by the employees. So that's why in fiscal year 25, which has ended, or I'm sorry, in calendar year 25, we were contributing 66 to 80%, whereas with the 5% increase in the district's contribution, the additional 8% is absorbed by employees. So that's why it goes down to a district contribution of 61 to 74%, depending on the plan that's elected.
Okay, that answers my question because I was wondering where the other 8% was going to come from, and it's going to come from the employees.
Correct. And unfortunately, we had to look at all options. If there was additional cost savings we could plan for, and we had looked at things that may have been more advantageous for the district. However, Sandy and I are spending a lot of time working with our staff who really recognize the challenges this hospital's facing, recognizing that they're very tired, they're very stressed, very concerned about this hospital. And it was a question of how much burden do we put on employees, and decided this was the most advantageous option for the employees, recognizing the work that they're doing in very difficult circumstances. But any additional money over this 5% increase that was planned for, we would have to find additional ways to fund that, anything over that 5%.
I understand. Thanks, Michael.
Absolutely.
I have no questions. You have any questions?
Yeah, I would just like to know if this funding or anything like that
Budget.
will have anything, will be affected by the government shutdown, if and when it changes.
So, Dr. Brooks, as of right now, this is not Medicare or Medicaid-based plans. This is a private health insurance. So to the best of my knowledge, there would be no impact from the government shutdown.
Would you advise voting for it yourself?
I would, since we are in the open enrollment period. And this is something we had already budgeted for, already planned for. And this is the most advantageous opportunity we can provide to our employees who are working in very difficult circumstances and giving their all to our patients.
Thank you.
Absolutely, Dr. Brooks.
Okay, I have no questions. So is there a motion to approve?
I shall move.
Second.
Okay, can we call for the question?
Vice President Rowell,
Aye.
Director Sargent is absent. Director Brooks,
Approve.
Director Hudson is absent. President Garnica.
Aye. Okay, item 6. I'm gonna adjourn the regular meeting of the Healthcare District Board scheduled for the 26th was canceled by board action. A board meeting will be held on Wednesday, November 19th at 6 p.m. at the council chambers, Blythe City Hall, Broadway. Unless otherwise stated in the proposed agenda. But November 19th is the day.